Hello everyone. Hope you're enjoying your anatomy lectures. I'm Dr. Hema and I'm going to start my first class with you guys today, and it's going to be on musculoskeletal system. And the musculoskeletal system is actually quite a long chapter. So what I've done is I've divided it into 3 smaller sections so that it could make your understanding a bit more easier. So if you're ready, let's just get started. Okay. When you talk about musculoskeletal system, the system actually is known as the locomotor system. And when you say locomotor, that basically refers to movements. Locomotion refers to movements, right? So it's a system that's going to allow you to move. Okay, it's an interesting system because this is one system that you can actually see and feel, unlike your other body systems, which are all internal to your body. This one is something that you can actually see them work. Okay, so when you talk about the system, it comprises of the skeletal system as well as the muscular system. And why we study them together is because neither of the system can exist without the other. Because imagine if you're just a skeleton, you will probably not be able to move, although you have a nice structure. I mean, your body has a defined shape, but you cannot move. And imagine if you're just muscles, without the skeleton. So you'll probably be just like a blobfish, a bag of muscles. You also cannot move because the muscles are not attached to anywhere to allow movements. So that's why both the system depend on each other for movement to actually take place. Okay, when you see the skeletal system, you'll be looking into some bones, ligaments, cartilages, and tendons. Okay, ligaments are connective tissues that bind two bones together, whereas tendons are connective tissues that bind the muscle to the bone. Okay, and cartilages are another group of connective tissues that are found in certain places of your bone that basically functions to cushion your bones or prevent frictions and so on. Okay, moving on to the function of the skeletal system. Basically, your skeleton supports your body and protects all the internal organs within your body. It aids the movement because it provides the attachment sites for your muscles. It stores nutrients, mainly calcium and phosphate. Produces red blood cells because at your red bone marrow, which is found in most of your long bones, the process of hematopoiesis, blood cell formation, actually takes place there. So it's an important place for blood cells formation. Whereas when you look at the muscular system, it's responsible for bodily movement because the contraction of muscles is what causes your bones to move. Your bones cannot move by themselves. It's the muscles that which actually pulls onto the bone that causes it to move. So with muscles, you have stability of your body because you have a nice structure, a defined structure that allows you to be stable. And also the group of muscles like smooth muscles are very important to allow movement of internal substance within your body, like your smooth muscles in your blood vessels, your gut system, your small intestine, large intestines, which actually aid movements of substance within the body. Let's start off by looking at the skeletal system. The skeleton is basically a Greek word meaning dried up body. And in the skeletal system, there are lots of bones. Mainly bones are what we're talking about here today. And bones are very, very interesting because every bone you have in your body is connected to another bone to actually form your skeleton. And in your body, a human adult body has about 206 bones. Of course, when you are born, a child has more, like about 300 plus, but eventually some of these bones actually fuse together, and at the end we only end up with about 206. And bones are an interesting group of connective tissue which we know as osseous tissue. They have cells and matrix just like any of your other tissues. Okay, and they are also highly vascularized. So when you say a tissue is highly vascularized, we can see the picture there. That's the picture of a bone. And all the redness that you see, the red color, it is a special stain that is highlighting the blood supply to the bone. So it's like there's a lot of redness there, so that means it's like there's a lot of blood vessels. So when a tissue has lots of blood vessels, we call it as vascularized or highly vascularized. And bones are also one of the only tissues that are capable of remodeling throughout your life, because there's a lot of wear and tear throughout your life. Bones actually constantly remodel. That means the old ones are broken down and new ones are deposited. So this is a very interesting tissue, because this is the only tissue is capable of doing that. And of course, bone is also very important to maintain your calcium and phosphate homeostasis in your body, because this is basically like the bank for calcium phosphate. You either store it there or you take it out from there when you need it. The process of bone formation is known as ossification. We will talk about ossification much later. And there are various factors that actually affect the growth of your bone, such as calcium and phosphorus, which are your main building blocks of your bone. So anything that could have an effect on your calcium homeostasis in your body, such as the calcitonin, the vitamin D, and parathyroid hormones, will indirectly affect the growth of your bone. So besides that, we also have growth hormones that are produced by your pituitary gland, which has a direct effect on the epiphyseal plate. Okay, epiphyseal plate is a region that is found in your long bones. Later, when I show you the long bones, I will tell you where this place is. So it actually affects the growth of your bone. So when you have too much of your growth hormones, that's where you have conditions of gigantism due to hypersecretion of this hormone. And if you have too little, then you have conditions of like dwarfism due to the hyposecretion of the growth hormone. So bones are basically classified based on either the structure or the texture. So when you classify bone based on structure, then you can classify them as either flat, long, short, or irregular. And based on texture, then you can classify them as either having compact or spongy-like appearance. So one of the easiest way we classify bone is based on its structure. So we have the long bones. From the name, you know that it is longer than its wideness. That means the length is more than the width. So this kind of bones are classified as long bones. Even small bones that you find in your fingers actually come under the classification of long bone, because they fall into the definition of the length being more than the width. So very good examples of long bones are femurs and humerus, and many bones in our bodies actually come under this classification. Compared to irregular bones, these are bones that do not really have a defined shape. And a very common example is your vertebra. They are like one of the groups of bones that actually come under the irregular bone category. And then you have the flat bones. From the term flat, you would expect this bone to be really flat, and that's what we call it to look something like a plate shaped. So you'll find this type of bone in your sternum, scapula, pelvis, as well as your skull. These are all flat bones. And the last group is the short bones. Short bones are small bones which are roughly the same length and width, so almost squarish in shape. So you find them in your carpals as well as your tarsals. And also the sesamoid bone, which is your patella or your kneecap. This also comes under the short bones classification. Now we're going to look at the structure of the long bone. So majority of the bones in our body is actually of this type, the long bone type, and it's actually divided into a few sections. Mainly it's the diaphysis or the shaft area, as well as the epiphysis at both ends of the long bone. The periosteum is a double-layered membrane that actually covers the diaphysis region. And when you look at the diaphysis area, you will see that it's made out of an outer shell of compact bones, and it has a marrow cavity in the middle. In adults, this cavity is actually filled with yellow marrow, whereas in young children you will find red marrow filling up the area of the cavity. And over at the end, the epiphysis end, you will find that the outer layer of the epiphyseal head is actually made out of compact bone. Okay, at the epiphyseal ends are made out of compact bone, and the inner part is actually made out of cancellous bone, or what we know as the spongy bones. Okay, besides that, you will find that between the epiphysis and diaphysis area, there is a region known as the epiphyseal plate. If you remember, I mentioned it earlier. So this is where the epiphyseal plate is, and this is where your growth hormones are going to have an effect on. And the epiphyseal plate is basically hyaline cartilages. It's made out of hyaline cartilage, which actually help the elongation or the growth of the bone as you grow until you reach a certain age. And after a certain age, especially when you reach your adulthood, this epiphyseal plate will no longer be there. It will cease to function, and what will be remaining at this region is just a small tiny line, which is known as the epiphyseal line, or the remnant of the epiphyseal plate. So at the ends of both the epiphyseal region, you have what we know as the articular cartilage. This blue structure that you're seeing here, these are articular cartilage. And the articular cartilage is basically hyaline cartilages that occur at the joint areas. So articular means joint. So this is the region where the bone is going to join to another bone. So the articular cartilages are there to actually help reduce the friction at the joint, as well as to absorb some of the stress that is occurring at the joint due. Bones could also be classified based on their texture. So when you use a textural based classification, so we can classify them either as the compact bone or cortical bone. The compact bone usually forms the outermost layer of most of your bones, and they're actually very hard and dense, and they consist of the structural units known as osteons or Harvasian canals, compared to the other group of bones, which is known as the spongy bone, also sometimes called the cancellous or trabeculae bone. And this type of bones usually make up the inner parts of the bones, and usually you'll find them in flat bones sandwiched between the compact bones, or at the ends of your long bones, especially in the epiphysis region. You'll find the spongy bone, and they're called spongy bone probably because they look like a sponge. There's lots of tiny holes that you can see occurring within the structure of the bone. So this literally gives the bone a honeycomb kind of appearance. And instead of osteons or Harvasian system, the spongy bone has what we call as the trabeculae as its functional unit. So all these random projections that you see here are actually the trabeculae. And within the trabeculae, where we can find this red bone marrow. So most of the bones in the body actually has a combination of both these compact and spongy bones. What's inside the bone? Like any other living tissues, bone consists of cells as well as matrix. So when we talk about bone cells, there is actually three main groups of bone cells, which is the osteoblast, the osteocyte, and the osteoclast. And the osteogenic cells are basically the stem cells that give rise to your osteoblasts. So if you have noted that all of these cells actually has the suffix osteo in front of them. So osteo is a term that always refers to bone. That's why you have terms such as osteoporosis or osteosarcoma, conditions that affect the bone. They always have this suffix as osteo. So in the future, or if you ever come across any terms or words that has the word osteo in it, you will directly or automatically you'll know that this is something to do with bones. Okay, so now going back to the bone cell itself, Now, when we talk about osteoblasts, osteoblasts are literally the bone forming cells. So these are the cells that are going to synthesize the bone matrix. So they lay down the bone matrix, and as they do that, as they synthesize the bone matrix, some of them get trapped within their own matrix in a small space known as the lacunae. So when they get trapped in this region, they have nowhere else to move. So what happens is they mature and they become the osteocyte cells. So osteocytes are basically matured bone cells sitting in an area known as the lacunae. And then you have the other group of cells known as osteoclasts. These are giant bone destroying cells. They literally break down the bone matrix to release the calcium. Okay, so the process of bone remodeling, which is the formation and breaking down of bones, is actually done by both the osteoblasts and the osteoclasts. They have to work together in order for bone remodeling to actually take place. So this is the image or a histology image of your bone tissue, where you can see the various types of cells. You have your osteoblasts, you have the giant cells, your osteoclasts, as well as your osteocytes, all sitting in your area known as the lacunae. Okay, when you look at bone matrix, you know bone does not only consist of cells, it also has matrix. So at their matrix, or what's in their matrix, is basically 25% of it is just water, and the other 25% is the inorganic component, which is made out of collagen fibers, which are either arranged in a random or a parallel orientation, and their arrangement will determine whether they have this compact kind of appearance or the spongy kind of appearance. And the rest, or the majority of your bone, 50% of it, is made out of the inorganic component, which is known as hydroxyapatite, which are basically minerals made of calcium and phosphate. So a bone has to have both collagen as well as the mineral part. That means both the organic and inorganic component of the bone is equally important, because what will happen if you don't have the minerals of calcium and phosphate? Then your bone has a lot of collagen, so it's so flexible, you can just bend it to whatever shape you want. So if that is the case, then you don't have strength. Your bone will be so fragile, and you literally can't, you can't even walk or stand or anything, because it will bend. But if you don't have collagens, you only have minerals like calcium and phosphate, then the bone is so brittle, it's so easily breakable, because it's just mineral. The moment you hit against anything, it will crack open, or it just shatters into pieces. So that is why both collagen and mineral are equally important to give your bone its flexibility, its strength, its structural ability to do its function. So that is why it's important to have both minerals and collagens in your bone. So if you remember the bone matrix arrangement, the collagen fibers that we were just talking about, you remember I told you it's either arranged randomly or in parallel sheet. So the arrangement will actually determine the appearance of the bone. So when it's randomly arranged, you will have this woven bone kind of structures. It doesn't have a proper defined shape, and usually these are immature bones. When the bones are really matured, the fibers or the sheets are actually arranged closely, or in a what we know as a lamella pattern. Lamella is this circular pattern that you see, that is known as a lamella. And mature bones usually, at the compact bones of matured bones, usually have this lamella arrangement of matrix. Let's look at the anatomy of the bone. Basically, your bone is made out of a few layers, and the outermost layer, or the membrane that is covering your bones, is known as the periosteum, which we find in the area of the diaphysis of our long bones. This is basically a type of fibrous connective tissue, And the periosteum is actually attached to the bone by what we know as these Sharpie's fibers. They are very strong collagenous fibers that attach the periosteum to the underlying bone. And just underlying your periosteum, you will find your compact bone. So the compact bone, you can see all these roundish cylindrical structure. So these are actually the osteons, or what we call as the Harvasian system of the bone. So these are the functional units of your compact bone. And just underlying the compact bone, you'll find your endoosteum. This is the inner membranous structure that actually lines the medullary cavity in the middle. Okay, but you also find this endoosteum lining the canals of your osteons, the Harvasian system, the Harvasian canals. You will also find endoosteum lining these canals as well. And right in the middle of the medullary cavity is where this is the microscopic structure of the bone tissue, and as you can see, the outermost layer of the bone tissue is the periosteum, the membrane that is attached by Sharpie's fiber, and underlying that is where you'll find your compact bone. So this whole structure here is the compact bone, and the innermost layer is the spongy bone. Okay, so when you look at the compact bone region, which is the outer shell of your bone, what we will find is the circumferential lamella. Okay, these are the matrix, the bone matrix arranged in parallel sheets forming the circumferential lamella. And then you have these structures known as osteons or Harvasian system, which is basically the functional unit of the compact bone. So the osteon, as you can see, is usually arranged in a circular manner. The matrix is arranged in a circular manner, in which we call this as a concentric lamella pattern. So concentric meaning that they have the same center. And at the very most center of your osteons, you will find what we know as the Harvasian canal, which consists of blood vessels and nerves. So this Harvasian canal is actually traveling all along the compact bone structures, and smaller canals known as the Volkmann canal actually allow communication between one osteon with the other osteon or the neighboring osteons. And within the osteons, you also find your osteocytes sitting in this area known as lacunae. You will find your osteocytes in the lacunae, and you'll find a lot of these tiny hair-like projections, and these are actually known as the canaliculi, and these are actually small passages that your osteocytes are using to actually communicate and exchange informations with each other. So over here in this image, you can also see all these lacunae and the nice concentric pattern of your lamella, of your osteons here. Okay, and when you look at the spongy bone in the middle, what we see is all these trabeculae. They are a bit different than the compact bone because they don't have this nicely arranged lamella, and we will look into the spongy bone shortly. And besides that, you have these endoosteums that actually line all these bony canals, and lots of blood vessels can also be seen penetrating both the compact bone and your lamella. They get into your bone. So this is the structure of the spongy bone. They are actually quite different from the compact bone, because they do not really have the nice lamella kind of appearance. But if you just take a cross section of the trabeculae, you will see that they have most of the components that are needed for a bone, which is they have osteocytes in their lacunae, they have the lamella, they have canaliculi where the osteocytes are communicating with each other. It's just that the lamella here is randomly arranged, and it's not following a particular pattern, either as circumferential or concentric in arrangement. Now we're going to talk about bone formation. When an embryo is formed, as it develops, usually you don't really have bones yet. Bones do not really form until about 8 weeks into the pregnancy. So what we have at the early stage of the embryonic development is actually all these fibrous membranes and cartilages that are actually there to provide the framework for future bone formation. So that's the foundation from where the bones will be formed. And normally the process of bone formation is called ossification. And in the human body, we have two ways in which bones are formed. We have the intramembranous ossification. Okay, the intramembranous ossification, from the term intramembranous itself, so you can take note that intra literally means inside, and membranous will refer to a membrane. So this is something that's going to start inside a membrane and then gradually form the bone. And normally flat bones like the ones on your skulls are the ones that are mainly formed through the intramembranous ossification process, whereas the other method of bone formation is known as the endochondral ossification. Okay, from the word endo, you know that it means inside, and chondral refers to cartilage. If you remember in your basic tissue, cartilage cells are known as chondrocytes, so that's where the term chondral comes from here. So endochondral ossification literally means that something that's going to start from inside a cartilage. So the majority of the bones in our body is actually formed through the endochondral ossification process. And normally the skeleton of human embryo usually starts to undergo the ossification process around week 8. That means about 2 months into the pregnancy. That's when the skeletal structure actually undergoes. So let's look at the intramembranous ossification. Okay, these are processes that you can't really understand by just reading them in one time or listening to them once. This is something that you need to repetitively try to read through and understand. And what I'm going to do is I'm going to post videos for you so that you can actually see the actual process, how it's happening, so you can understand them, because it's quite complicated to actually understand it by listening to this lecture. But however, let's just try to briefly go through this process. The intramembranous ossification, as I told you, usually happens in the skull bones, the flat bones, and often around the week 8 of the embryonic development, the mesenchymal cells on a fibrous membrane actually come together and differentiate into osteoblast forming cells, and they form what we know as an ossification center. Okay, it all starts off with the formation of the ossification center. Then the osteoblasts gradually start secreting osteoids or bone matrix. Okay, it starts secreting the osteoids, which with help of certain enzymes and hormone, they start adding in calcium to it and becomes calcified. The process of calcification, or the actual bone matrix formation, starts to happen. And this is also a stage where some of the osteoblasts get trapped within their own matrix and mature to become osteocytes. And as more and more osteoids are laid down, a network of trabeculae is finally formed, and that gives rise to the structure of the woven bone. Okay, so as more matrix is accumulated in this process, you eventually end up with the woven bone. And surrounding these structures, they start getting blood supplies. Blood vessels start forming, because some of the surrounding mesenchymal cells, they eventually differentiate to form blood vessels, and they start supplying blood to the newly formed woven bone. And eventually some of the outer layer, the mesenchymal cells in the outer part, will condense to actually form the periosteum. So the final stage in your intramembranous ossification process is when the lamellar bone replaces the woven bone through a process of remodeling. Okay, so the stage occurs when trabeculae near the periosteum thickens to become mature lamella, and spongy bone consisting of obvious trabeculae remain internally and is vascularized tissue becoming the red bone marrow. So whatever blood vessels that were coming into the structure of the woven bone in step 3 here eventually will become the red bone marrow at the stage 4. So that's the process of how intramembranous ossification actually takes place. Now we're going to look at the endochondral ossification. So this is a process that is undergone by most of our bones in the body except for the skull and the clavicle. So other bones are actually literally formed through this process of ossification. It's more complex than the intramembranous ossification process because it's using the hyaline cartilage that has to be broken down as the ossification proceeds. So we'll look into this process by using the long bone as an example. So what happens is the process actually starts with the formation of the primary ossification center in the middle. Okay, so following that, a bone collar forms just around the edges of this center, at the sides of the center, around what we know as the diaphysis. This area is going to become the diaphysis of the long bone soon. Okay, so because the bone collar is formed, the bone collar forms because of some of the mesenchymal stem cells that have become osteoblasts and secreted some matrices to form the bone collar. So when the bone collar is formed, what happens is nutrients are unable to diffuse into the center of this cartilage, and eventually the cartilage matrix will deteriorate and die, forming a cavity. So when the cavity is formed, blood vessels from the periosteal bud, okay, periosteal bud is a structure that contains your arteries, veins, lymphatic vessels, nerve, your red marrows, elements from your red marrows, and as well as osteoblasts and osteoclasts are actually penetrating and coming into the area in the middle here. So since now you have your bone cells are entering to this place, the process of eroding the cartilage matrix starts happening, and new osteoid matrices are being laid down at the center area, forming what we know as the spongy bone. So as the primary ossification center enlarges, the newly formed spongy bone is also broken down to open up a medullary cavity in the center of the diaphysis. So at the end, by the time of birth, what happens is this area in the middle has now become an empty space known as the medullary cavity. So at the ends, the epiphyseal, however, is still very much cartilage. Okay, the epiphyseal ends are still very much cartilage, and they cause the bones to still grow in a elongated manner. That means they still grow longer. And just at birth or just after birth, you can see here the baby is already being born. What happens is a secondary ossification center starts forming at the ends of your epiphysis. So it can be in both ends or just at one end. So when the secondary ossification center forms, the epiphyseal blood vessels then invade into this area and cause the formation of spongy bone. It's just same as the primary ossification center, but it's happening at the epiphyseal ends just after birth. But the interesting thing is, unlike the primary ossification center, you do not get it replaced with an empty medullary cavity, but the spongy bone just remains as it is. Okay, so forming no cavities at that area. So that's why your epiphyseal ends are always consisting of spongy bones. Okay, if you remember. So at the end of this entire process, the cartilage is still remaining at two areas of your bone. One is at the ends of your epiphyseal plate as articular cartilage, and the other one you'll find it between the diaphysis and epiphysis over here as the epiphyseal plate, which eventually causes you to grow taller as you grow from childhood to adulthood until the epiphyseal plate cartilage cease to grow anymore. So this is the whole process of the endochondral ossification. So okay, for you to actually understand this process better, you have to look into some of the videos and look up into some other sources so that you can visually see how this process actually takes place. So that's the image of a baby. As you can see, they there are a lot of this bluish area in the skeleton of the newborn baby, and this indicates that these are all still very much cartilage. They have not been calcified as solid bones yet. So that's why the babies are actually very flexible. You can just move their leg all the way up to their head, but which we really can't do. And that flexibility is actually given by all these cartilaginous tissue that are still existing in their skeleton. And also, if you note, their skulls are also very much, usually a baby's head is very much bigger because the bones have not fused yet. And often, if you know, people will tell you, please don't touch the soft spot of the baby on the top of the head. So this is the area known as the anterior frontalis. So you can see the opening there is actually quite large. The bones there have not fused yet, so there's underlying meninges down there. So normally we do not encourage anyone to touch the baby's soft spot. So that is the spot. So I hope you could understand this lecture, and if you don't worry. Just go through the notes again and look at some of the teaching materials that I'll be posting so you could understand it much